Good evening everyone. As I am planning to make videos on pharmacokinetic dosing of antibiotics, I decided to make a small video on how to use a form which is used for pharmacokinetic dosing of antibiotics, mainly vancomycin and aminoglycosides. So as I plan to make those videos in future, please subscribe to the channel so that you can follow those videos too in future. This is actually an one-sided, one-page form, but the form has three different portions: top, middle, and bottom portion. I'll try to explain these three portions separately. So on the top right hand corner, where you are seeing an empty space on the form, is for writing patient's name, date of birth, patient age, and the patient's room number in the hospital. On the left hand side, you can write the patient's date of starting the antibiotic, which in this case will be vancomycin or the aminoglycoside, and the place for writing the doctor name who is ordering this antibiotic for the patient. If there is any infectious disease doctor on the case, then we prefer to write that infectious disease doctor name on that form at the place of MD. Then there's place for writing patient's allergies. If the patient has any allergy to any medicine, then there's a place for writing patient height, weight, ideal body weight, and dosing weight. The weights we want to write as kilogram, not pound, because vancomycin dosing are done by the kilogram of patient's body weight. The dosing weight can be patient's actual body weight or adjusted body weight based on the policy of the hospital of dosing antibiotics. At the place of HPI, which is history of present illness, you will write the patient's condition or disease for which the antibiotic is ordered, and also some of the pertinent illness or condition the patient is facing, which keeping the patient at the hospital, meaning like what are the present illnesses the patient is going through for which the patient is staying in the hospital, with particular emphasis to the infections for which the antibiotic is being ordered. In the PMH place, which is past medical history, we try to write down the patient's important history, medical history, specifically related to renal function or diabetes, so that we don't miss them when we are doing the vancomycin dosing. If the patient has any amputations, that we also want to place here. Then there are boxes for choosing the antibiotic for which this form is being used. Is it for vancomycin, tobramycin, gentamicin, or amikacin? And what is the goal peak or goal trough for that antibiotic in microgram per ml? The gray bar on the top is for writing the date for which we are writing that values of the patients. The values that we want on this form are Tmax, which is temperature maximum, BUN, blood urea nitrogen, SCR, serum creatine, and WBC. And we will write them on a daily basis in each of the columns. And then there's place for writing patient creatine clearance. And as we order the patient's trough and peak, then we'll write down what values are coming for those results. And if we order any random level, there's place for writing the random level too. And we want to write down both the value and what time the lab was drawn on this form. The middle portion is basically for writing the medication administration record of the antibiotic. We'll write down the date and the day number, which is on what day from the beginning of the antibiotic starting the patient is on. Dosage regimen means what dose and what frequency the patient was on that day. And the time given is at what time the antibiotic was given by the nurse to the patient. This helps if there is a missing dose for the patient, like if the dose was missed on a particular day for any reason, then we can look at this portion and figure out if the antibiotic was given or not on that day for the patient by the nurse. The bottom portion is for writing the culture and sensitivity data. Here we will write on what date the sample was drawn, and then the source, which will be from what source the culture is being done, meaning like is it from blood, urine, CSF, cerebrospinal fluid, or is it from bone or abscess, from whichever source the culture is being done, and then what result is obtained from that culture, what microorganism was growing. It can be also no growth, and then also place for writing the MIC, which is minimum inhibitory concentration for that antibiotic for that microorganism. We'll write down that at this place of the form. So you saw in this video how a form is used for vancomycin and aminoglycoside dosing at the American hospitals. So please subscribe to the channel, as I plan to make more videos on this about vancomycin and aminoglycoside dosing in future. See you next time. Thank you.